Welcome to another episode of Hatching for Health with your host, Jessica Hatch. Today we're going to be joined by a lovely family. They're out of Corpus Christi, and the child has Childhood Apraxia of Speech. That's a mouthful. So they are going to be coming on actually via a video call, but we are able to have a lovely guest here, and she is a speech pathologist therapist. So she will be joining us actually to start with, and we'll get to talk to her a little bit about her work. She does own her own organization, and I'm looking forward to hearing from her just all about it. So welcome to the show, Nicole Bishop. How are you?
Thank you. I'm doing great. Thank you for having me.
Yes, we are just blessed to have made it work where with all this, COVID going on, it's been difficult to have people on set, which is why the family is calling in, but you're here, so that's great. So tell us a little bit about, this is your company that you've had now for 6 years. And tell us the name of it and a little bit more about it.
So I've actually been with Speech Therapy Works. I'm the owner and speech language pathologist there for the past 3 years. And prior to that time, I worked at Texas Children's Hospital and the University of Houston. So I have a broad variety of patients across the board, ranging from autism spectrum disorder to childhood apraxia of speech.
Wow.
Stuttering, so a lot of different areas in both children and adults.
It sounds like it. Yeah,
Yes.
That's a broad spectrum of what you've been able to, to do with hospitals and even on your own. And so where's your location at?
We are located in Sugar Land, Texas. We're
Okay.
actually building a new location on 800 Bonaventure Way. So we have a new expanded office that will be opening in August.
Great. So you'll just kind of pick up and you won't miss a beat. You'll be able to maneuver over and continue. Awesome. Have you guys been busy through all of the, COVID existing right now?
We have been busy. We've actually been busier than ever because a lot of locations are closed, and we're thankful to be open, providing both in-person and teletherapy options.
Okay. So I guess some of the precautionary things, are y'all doing the check of the temperatures, the mask and everything, like most businesses that are able to stay open are doing?
Yes, ma'am.
Okay, wonderful. Well, we are going to have the family come on because I know they are patiently waiting, and I want to be able to have y'all speak a little bit, kind of once we get up to speed with what's going on with their family and understand, when Clinton was diagnosed. So, are you guys there?
Yes, we're here.
Awesome. Welcome, Jessica Prescott and your son, Clinton. How are you guys?
Great. How are you?
Great. So you guys are in Corpus Christi, is that right?
Yes.
Okay, very good. So I know I had the chance to meet y'all several years back when Hatching for Health was being filmed out of a different location, and it's been a few years. So I know at that time, y'all were somewhat new to the experience of having a child with childhood apraxia of speech. I'm sure you guys have overcome a lot of obstacles with that. So kind of tell me, kind of take us back. I mean, there's a lot of people that, weren't aware of Hatching for Health, weren't aware of your story. So let's start from the beginning. Like, when was Clinton, diagnosed, and what was it that told you guys something was different?
Right. I guess he was officially diagnosed when he was 3. However, as young as 1, the pediatrician was telling us to, take him into speech therapy for just an evaluation. I guess maybe he wasn't babbling as much as a typical child his age would be. And I unfortunately kind of brushed it off as I was too young. How is he supposed to be talking right now? So I didn't put in speech at that time. And then, fast forward another year, then I finally did at 2 years of age start putting him in speech. And they would bring up the word apraxia, and no idea what it was. They helped us with speech delay.
Yeah, of course.
And then I officially diagnosed.
Okay, and this, from what I understand too, this is a very, rare condition, not as rare as some things, but I believe it's 1 in every 1,000 is diagnosed with it. So for the help that's out there. I mean, it is there, but it's not on every, corner. So how was that, once you knew what he was diagnosed with, and just finding the right help?
Right. Yeah, that was difficult too. We honestly bounced around kind of from therapist to therapist to find the right one. And well, I guess we got lucky. We put him in a school that
inclusion.
Right, but
Kind of like a school that had various type of therapy there, but one of it was speech therapy, or?
And then I recommended a speech therapist, and we've been with her for 2 years now, and she's great.
And I'm just going to actually make sure you guys, so Nicole Bishop here is a speech therapist pathologist, or speech pathologist therapist?
Speech language pathologist.
Speech language pathologist. And so with actually a doctorate, is that right?
Yes,
ma'am.
yeah.
So she took it all the way, pretty much as high of a level of education you can get. So I was going to actually turn to you on that. So when you have children come, is it always that they were diagnosed, with something and they're coming to you knowing, or a lot of times are you actually personally the one part of that diagnosis?
It's actually the latter, and going off of what the family was saying, it's so misdiagnosed and not commonly identified at an early age.
Okay.
Because it's not something that is typically diagnosed in one session.
Okay. And you can actually, so the family, you can actually kind of tell, kind of talk right to us. We're all talking now to the family as well. So they're coming into you and they're actually speaking, or kind of clarifying at that point what it is that is going on. Is that right? Is that right, Nicole?
Yes, that's correct. A lot of times children are identified between the ages of 18 months and 2 years for having some signs of childhood apraxia of speech, but oftentimes they don't identify it, really making that final diagnosis until closer to the ages of 2 and 4, when children start speaking more.
Okay. And Prescott, I just want to kind of turn to you. How has it been, as a father, and just kind of from the moment he was diagnosed and handling it? I know there's always different bonds between the mother and the son and the father and the son, but just kind of tell us a little bit about the experience that you've had, with your son having this.
I would say it's just like an experience with any other kid. I mean, there's challenges everybody faces challenges and faces hurdles. Clinton's just facing one a little earlier in life, so he's tougher than most other kids, and he works harder than most other kids, and I think we all bond with him because we work so hard with him. And besides just me and Jessica, he has a whole family of aunts and uncles and grandparents that are all very active in his life. And of course with the school, which we love, the Rise School here in Corpus Christi, and the help that they've instilled a lot of confidence in him, and I think that's really important. We've always tried to, at home, get him more confident with things, and hoping that, open him up, because I don't know if you agree, but just practice is probably most important. And if he's not confident, he's not going to practice.
Yeah, no, definitely. I think with anything, right? Whether we're, it's sports or, being an artist, or language and, in general, it's definitely just the more you practice, the better you get, and confidence comes with that. Just as parents, is there certain advice that you would give? Because, ultimately, we bring you out here, to be bold enough to tell your story, but also there is families out there that they don't know yet what's going on, and they might hear this and realize, this might be why the delay is there with our child, and maybe we need to go out and actually see a doctor or meet with a therapist to see if maybe these symptoms match up. So is there maybe any advice you would give kind of on the onset of knowing that that speech was a delay?
Yeah, just being diligent, I guess. Just don't, I think most parents with some needs that might be special needs for their kids, you take a little while before you're going to maybe admit that to yourself, and just be proactive. If there's some sort of a delay or a pediatrician mentions something, we've been very proactive.
Mm-hmm.
Starting just like you mentioned, from the 18-24 months when you can't really tell to really going through that testing and really getting a good definitive answer of apraxia of speech. We kind of went with it early, and
Mm-hmm.
the earlier you did, the earlier and such a minor little hurdle to get over. There's some families out there with a lot more difficult things, so I don't want to speak for all that, but it's tough to admit to yourselves and for everybody in the family, because then you've got more people that don't want to admit it.
That aren't familiar with it, and it's educating them, and kind of so you could all be a team at it.
Yeah, that's the toughest part. It's just believing and just moving forward.
Mm-hmm. I can.
Look at them as a point.
For sure. And I want to get Nicole's perspective. We're going to take a quick commercial break, but when we come back, we are going to kind of ask Nicole some of the advice that she can give families that, may be learning that their child has some of these same symptoms. We'll be right back with you.
Hi, it's Jessica here with Infinity Diagnostics, located here in the heart of Houston. Follow me in, I'm going to show you our MRI machine. We have a 1.5 Tesla Siemens magnet. We're able to perform imaging on your spine and multiple other areas. So please come give us a visit for all of your MRI needs. Jessica here again. This is our Skull Pod machine. This is a great machine if you are looking to do any type of skin tightening or even reduce cellulite. You just crawl inside and you're in here for a total of 15 minutes. But previous to getting in, you are going to rub a cellulite cream all over your body. So that's going to help with the reduction of cellulite. So if you are looking for another option to weight loss, please stop on into Infinity and try our Skull Pod. Hi, Jessica Hatch here with Infinity. One of the things that we offer is interventional pain management. So I'm going to show you our pain suite so you can be more familiar with these services. Follow me. We have our C-arm where we are able to do interventional pain procedures that would include the spine as well as any joint injections that you may need. So if you are in pain, please come visit us so we can take care of it.
Being diagnosed with a scary sounding disease can be frightening. Imagine what it's like for your child.
There are over 7,000 rare diseases around the world affecting children.
Join me, Jessica Hatch, along with leading experts to help break down medical lingo, explain why and what their little bodies are feeling. Real faces, real stories, and expert advice.
And you can watch us on the biggest South Asian TV network in North America, NTV Houston. Hi, Jessica here. We are in our sleep center on the second floor of Infinity, and I wanted to show you a little bit about what we have here and what to expect when you come and have a sleep study. We have a lovely setup here for you so you can feel comfortable and feel right at home. Our technician will walk you up and he will connect you to all of the electrodes so that he is able to get the correct diagnosis while you sleep. So if you are having any sleep problems, please come visit us at Infinity so we can help you and put you on a pathway to better sleep.
Welcome back to Hatching for Health. For those of you that just joined us, we have Nicole here, who is a speech language pathologist, And she is joining us due to the fact that we have a lovely family out of Corpus Christi that has childhood apraxia of speech. So we are engaging, the relationship here for advice for not only each other, but for those of you watching that may or may not have a child with childhood apraxia of speech. So thank you guys again. I wanted to kind of continue our conversations specific to you, Ms. Bishop, and as it relates to what we were talking about, the family kind of had touched on, if you feel your child has certain symptoms, these are the things to look for, and this is kind of what you should do. Give me that advice from your perspective as well, because I'm sure you have people calling or maybe just afraid to call because they don't know if they fall in line with exactly what it is you do. So touch on that for us.
A lot of the red flags that we see for childhood apraxia of speech relate to delayed babbling, delayed onset of first words. We often see some groping patterns and difficulty associated with pausing. So for instance, if children are trying to say the word banana, they might say banana, presenting with different stress patterns. And we see difficulty associated with prosody and rhythm.
Okay, very interesting. And you personally, you actually grew up with a speech impediment, is that right? And that kind of inspired you to be doing what you're doing today?
Yes, ma'am. I presented with an articulation disorder, so difficulty producing my R's and L's. And this definitely is the path that I always wanted to follow from an early onset.
Okay, so you personally met with speech therapists growing up to, kind of overcome those difficulties, is that right?
Yes, ma'am, and that's something that I'm very grateful for my parents for advocating with me on, because I think that early intervention is key, especially with childhood apraxia of speech.
Yeah, it makes a lot of sense, and I think you guys are obviously on the right path and doing the right thing, Prescott and Jessica. And just kind of tell us a little bit about, day to day and kind of what his routine looks like, and the ways that there's obviously a lot of normalcy for you guys. This isn't something that, he's having to see a ton of doctors for as it relates to just being a healthy little boy, of course, but still kind of walk us through just so, us and the viewers understand, what it's like having a child with that disorder.
Right. So when he was, getting diagnosed, and when he was diagnosed, and the first 2 years of intense therapy, it was a lot of therapy. I mean, he was going 4 times a week. It would go from 30 minutes to an hour. But as of about this year, he's gone down to twice a week, 45 minutes. We are thankful to have him in that, the school that also provides speech therapy. So he's getting therapy at school as well.
Okay. So he's kind of going to his typical classes, but then there is a, 1 30 or 45-minute session of that day that is specific working on his speech.
Yeah, sort of. It's one-on-one at school. It's really just like 5 minutes, but they do group activities, which I like, because then he sees the other kids, practicing, and then he gets to, and it's really wonderful.
Yeah. No, I think that obviously does a world of difference. Like y'all were saying earlier, just gaining that confidence. Like if you're the only one, sitting there working with someone consistently, it makes it difficult to know, the struggles that other little boy or girl is facing, and to see that firsthand, for sure. So Clinton, are you able to tell us what's coming up this Friday for you?
Clinton.
Is there going to be a graduation of some sort?
Can you say yes? Come on, use your words.
It's definitely not a no, right? So give me a yes, huh?
Say yes.
I know you've got it in you. He's so cute. I can't handle it.
It's been a long day.
Yeah, I know. It's
Yeah, and he's a lot more talkative.
so you guys have. Sorry, what was that, Prescott?
Oh, I was going to say he's talking a whole lot more just in the last few years.
Yeah.
You know, most of it we understand, you know, and other people too. You know, we took him. He was tested at a school to get in to a school because developmentally he's on track with everything. It's just speech, which is also challenging because you've got somebody, I mean, without communication comes frustration and all that. And so you've got somebody that understands everything going on. And so even he's understanding all this, and it's not fun for him.
And that's that's one of the things from what I've read too, is they know what they want to communicate. They know what they want to say, but neurologically, like, it's not connecting for them. And so they're having to have that, you know, consistent therapy and stuff. But it's like, don't let that, I speak to the families out there, don't let that take anything away from the intelligence, because from what I remember, he's very intelligent with, just his level in school right now. I think even when he was 3, y'all were kind of telling me about that. So, just the part of it, the communicating part, it's like, frustrating, but it doesn't take away, in any way from the intelligence of them, definitely. So is there any other advice that you can, give their family? I mean, you kind of understand that they've, from about 2 or 3 years old, he's been diagnosed. They're 6 now, fortunate to have, sounds like, be with a good therapist out there in Corpus Christi, but is there anything that you can kind of think of that might be advice for them or even others watching?
Yes, and I think that this family is so blessed in that they've had so much support. It sounds like from the school, from outside therapists, from the pediatrician, and sadly that's not always the case. So my greatest advice would be to create a team, a collaborative team of medical professionals that are all on the same page, making sure that the goals are the same, making sure that everybody's able to monitor progress, and ensure that all of the goals are catered to the needs of the child. Yeah,
definitely. And now, Jessica, Prescott, Clinton, are y'all still with us? Oh, I think they might have disconnected there. I was just going to kind of touch on the rest of their family because if you can bring them back. I wanted to mention, I know that you guys have had, two little ones joined your family over the last few years. So you have another little boy, and what's his name? Hewitt, okay, and then a little girl here not too long ago.
Yes.
Okay, so you guys, family of 5. Man, I bet y'all are exhausted.
Yes. Especially
in the evening time. So that's impressive. I've kind of followed y'all through Facebook and just seen your family grow, and it's quite beautiful. I hope to just start trying to catch up one day soon. At least start with one. I mean. Yeah. So, well, if there's anything else that you want to, ask Ms. Bishop or mention to families, please take the opportunity to do so.
Well, for Ms. Bishop, so you've had exposure to childhood apraxia of speech. So for families that are kind of new to it, what should they be expecting? Does everybody end up having full communication? What like ages do you start seeing a huge, shift from communication being poor to strong, that kind of stuff?
That's an excellent question, and it's one that I receive all the time. I think the biggest struggle is associated with the fact that there's no, one-size-fits-all approach. So I can't give an exact answer of when every child will start speaking, when every child will start forming sentences, but I will say that every child is unique and special, and every child has their own form of communication, whether that's through an augmentative communication device, or whether that's through gestural language or verbal language. So I think that going off of what I was talking about earlier in terms of goals, making sure that it's catered to the needs of your child. So looking ahead at his specific goals, meeting with his therapist to see where he's at, checking in at the 3, 6, 12-month mark to make sure that those goals are continuing to progress forward.
Thank you. That's an excellent answer. I would just wanted to, maybe personally add to that. Have you seen in working with children since it's been 6 years now, I guess kind of, in this field, hands-on with children, have you kind of seen any large leaps, that they've made,
Yes.
from, over the course of a year or 2 years in this area of apraxia of speech?
I have, and some of the greatest leaps are the small steps. A child saying "mom" for the first time is a huge goal that constantly brings tears to my eyes.
Yeah, I know.
But I've had children that have started with a device and have moved to verbal communication.
Okay, so the device is actually encouraged partly to help with the communication coming sooner, would you say?
It depends. It's a client-specific case. I mean, it's definitely not to take the place of speech, but to augment it.
Okay.
So not every child needs a device or is
A candidate for one.
right,
Okay.
exactly. But some
see.
children do present with gains via device. Some children have verbal language, and we're able to augment that. So
Okay. Did that answer your question, you guys? I'm sure it did. I know we keep cutting back and forth to.
Yeah, I mean, we've been kind of involved in learning a lot in the past, I guess, 5 years. So that was more. I know, of course, there's no real answer to that. It's kind of, directed to the audience.
Yeah.
The other thing. Neither of us know.
Okay. Yeah.
So yeah, again, stepping back to, I guess, confidence for Clinton, it's been huge. He is shy in front of children.
Okay.
For the most part, but he opens up more around adults, faster around adults, and he has started with children too. And with that, it allows him to talk more, and the more he talks, the better he gets at it.
That's great. Yeah.
And like we said, we've done speech camps, apraxia camps. We've been involved with the apraxia walk, trying in San Antonio, trying to get one here and started in Corpus. The Apraxia Day that we got in Corpus with the mayor. The proclamation for Apraxia Day. We've been active with it.
I'd love for you guys to even provide some of the links to some of the organizations y'all have been a part of, because when this does go live on Saturday, I always like to, add in there resources for people. Obviously, they can reach out to Hatching for Health, but then I like to plug them in with, different organizations that can create a team around them. So we do need to kind of wrap up. Did you want to say something else?
I just had one more question. Yeah. Miss Bishop, do you typically see with children with apraxia, do you see them having other disabilities also, or is it just that?
That's a wonderful question. And honestly, it's very rare that we see children diagnosed with only childhood apraxia of speech. Autism spectrum disorder is very commonly comorbid. Sometimes we have children with epilepsy, cerebral palsy. So it's very common that we'll see children diagnosed with multiple disorders as well as childhood apraxia of speech.
Interesting. Very interesting. Yeah, and that's one of the things as well for all of you viewers watching. I definitely will, allow her information to be a part of the episode, and I'll have that, kind of underneath, where you can email us at info@hatchingforhealth.org, so that you will be able to be directly put in contact with Nicole in her clinic, as well as, any questions you might have for the family personally. I'm more than happy to connect you with them, so you can have that, personal conversation. I'm sure they'd be more than willing to help, being that they're willing to come on and talk to us. So thank you, Clinton, Prescott, Jessica, for being a part of it, and Nicole as well.
Thank you.
It was a lovely episode, and I learned a lot. So thank you all.
Thank you.
And thank you also, Nicole, for being here. It was very special to have you. And thank you for all the viewers for tuning in. And we look forward to you tuning into the next episode of Hatching for Health.